Hello. So for this week's journal, when discussing a patient that I recently had an encounter with, there was a 46-year-old male patient with a diagnosis of bipolar 1 and also opioid abuse disorder. And he was abusing these opioids. And his cause was he had recently had an amputee. Well, it wasn't recent, it was more like 2 years ago, but that is what started him to using opioids and becoming addicted. During the visit with him, there was a individual therapy meeting done with him, and we were working on some managing his mood instability because he does have mood issues due to his bipolar, as well as the cravings that he has for the opioids. And we were focusing on building coping skills for him and helping him figure out ways to handle his triggers. And his biggest trigger, of course, was just, he said every time he looked at his leg, it made him think of pain. Even if he didn't feel it, in his mind, he felt it. So some of the things we were working on with him is building, like I said, coping skills so that he would not be triggered as easily. We did use cognitive behavioral therapy as the therapy modality. And it was to challenge his autonomic thoughts and identify patterns that contribute to his substance abuse behaviors. And like I said, most of that came from the amputee of his leg, but any type of life stressors also had him at the point where he wanted to use drugs. He currently was 4 months free of using any opioids. And but he did recently have an admission into an acute setting because he had some mood issues going on with his bipolar disorder. The session that we did with him, it emphasized identifying high risk situations and developing a relapse prevention plan. And he did do that. We were able to conduct a plan with him. When comparing these type of situations to the adolescent and pediatric community, there are a lot of different things that we have to consider. Some of these include the developmental stage, what age of development where they are mentally, where they are physically, emotionally, with the developmental stage. We got to consider substance abuse behaviors and the social and their emotional development. So a lot of times when kids are a certain age, even though they try to do grown people activities, they still have the emotional state of a child. So it's not as easy for you to get things over to them and get them to understand it and get them to put a plan in place to make themselves better because they let their emotions take over as well as their social environment. So that's one of the number one things that come into play when it comes to that community of patients, population of patients. Also, their parental involvement. A lot of times, sadly, a lot of children and adolescents don't have a support system. And that makes a big difference. If you don't have parents to support you, be there for you, and are more willing to listen than to scold you and fuss at you and tell them that they're doing what they're doing wrong versus trying to help them do better, then a lot of times those can be the triggers to set them off all over again. So the support system makes a big difference. I've had kids when I used to work with them who had family members who wanted them to be great, and I had children who had no family at all. They were only in the foster system and group homes. Also, something that's very important is peer influence. The episode peer pressure is real. So a lot of children, they, regardless of what an adult is telling them, it doesn't matter because to the kids in the neighborhoods or the kids in school with them, if they don't do what they do, they're not cool. So no matter how much therapy they get or how much redirection they get, they don't want to listen because they feel like when they go inside the outside world to those kids, they're not cool anymore because they're not doing the drugs that they're doing and they're not getting the help that they need. Not just with the drug abuse, the drug abuse, but also with the diagnosis of bipolar. They don't like to diagnose kids that young with the diagnosis, but when those different moods come in and they need some type of therapy, or if it's just behavioral therapy and some type of help, because we're at this point saying they're behavioral versus actually saying it's a diagnosis of bipolar, kids don't want to seek help because it's a stigma. So they're worrying about what other kids have to say, the kids in the school. They don't want to be labeled as something wrong with them or mentally ill. So peer pressure is a major category in anything involved with adolescents. So that is how I find what I find very important with that population of patients. And yes, I do see myself working with them because I already have. I've been actually working in mental health for the last 5 years, and 4 of those years were with adolescents. I did a residential program, and I also did the acute setting. I recently stopped working with the acute setting because they transferred the kids to a different department at my job, but I love working with them. It's a special feeling that they give you when you see them come in challenged and hurt and going through things, whether it's a mental health disorder, whether it's behavior, whether it's trauma, and to see them be able to get the therapy they need and get the help that they need and leave better so that they can grow up and be successful even though they may have had a rough childhood. And that about sums it up. Thank you.